So we want to actually look at an inflammation of the bladder, and this is what is known as what the interstitial cystitis. Interstitial cystitis. So for this interstitial cystitis, it's also known as what bladder pain syndrome. Okay, so it's a chronic condition. It's chronic condition meaning it doesn't just happen overnight. It has started from something very small, so it's only getting bigger simply because attention wasn't given to it. So there's recurring pain, there's what pressure, there's discomfort in the bladder and the pelvic region, right? So this itis here show you that there's what an inflammation. So causes of interstitial cystitis is the exact cause is unknown, right? But different things can now be suspected, right? So bladder lining defects, autoimmune conditions like your own immune system is what attacking the body cells, nerve problems, so abnormal nerve functions or sensitivities, okay, infections, yes, right, one of the most common suspicion. So infections from bacteria, infections from viruses, and all of that. So symptoms, all right, how would the patient be feeling? So there's pain in the bladder because of pressure, and all of that. There's urinary frequency, so the person is urinating very, very fast, and the amount of urine is usually very, very small drops. Urgency, okay, painful urination, then pelvic pain. So there's discomfort in the pelvic region, including lower abdomen and back and genital area. So diagnosis of interstitial cystitis, medical history. So you are trying to ask about all those. Do you urinate fast? Is it small? Do you understand? All those urinary urgencies and all of that. So physical examination, that's where you're now trying to do some palpations to check out things for yourself and all of that. Then urinalysis, you are trying to do some tests for urine to see if there's any infections, blood in urine, proteins in urine, cast in urine. Then cystoscopy is examination of the bladder and the urethra, okay. Then potassium sensitivity test to assess bladder sensitivity. So treatment is sometimes you might just have to do some lifestyle changes. Then sometimes drugs, depending on what you are feeling. Okay, depending on what you are feeling. If it is pain, you use drugs that will relieve you of pain. So bladder installations, physical therapies, surgeries in some cases. Surgeries may be done to address underlying anatomical issues.